Hello, and welcome to the Innovation Zone Data Collection Information Session. Before we get started, I just want to make sure that you can hear me. If you can hear me, if you could go ahead and type into the chat box. Great, and I just want to see who's on the call. So if you could just type your name into the chat box, that would be great, into the question box. Okay, great. We're going to hold on for just 1 second and see if anyone joins us. Okay, great. Let's go ahead and get started. Just want to make sure that everybody can hear me. If you could go ahead and type in whether you can hear me or not into the question box. Great, I'm getting a few responses. Great, looks like everybody can hear me. All right, I'm going to go ahead and get started then. Thanks for your patience as we start a little bit late. We might have a few people joining us, so we'll just let them pop on when they're able. So thank you so much for your time today. My name is Renee Tedrick. I'm the Program Innovation Analyst at Illinois Action for Children, and I'm here to talk to you a little bit about data collection for the innovation zones. So thanks so much for joining us. So data, we're going to talk about data, and just a few notes too before we get started. If you have a question, feel free to raise your hand. You can raise your hand if you have a question, or you can type into that question box. Okay, so feel free if you have a question, raise your hand, or type into that question box. All right, so data. When you hear the word data or data collection, what's the one word or phrase that comes to mind for you? So go ahead and use that question box there and let me know what thoughts or feelings come to mind when you hear the word data or data collection. Okay, I'm getting a few responses. I hear fear is one thing that's come to mind, a lot of work, innovation zone, paperwork. Great, what else? Great. I've been going out to our different innovation zone communities, and some people are saying things along the lines of it gives information, it helps us make decisions. Someone else here said results. But there are also some things such as it's anxiety producing, or it's confusing, or it's unclear, that sort of thing. And so I'm here today to kind of clear up any confusion and reduce any sort of anxiety that we feel around data collection. So sometimes it can feel like we're collecting all this information without really knowing where it's going. I love this little cartoon. Get all the information you can, we'll think of a use for it later. And that's often what it can feel like, right? We're collecting all this information, it's going off somewhere, we don't know what it's used for. And that can feel really frustrating, right? Well, we want to let you know that there is a plan, there is a purpose for the data that we're collecting. And Teresa Hawley at the Governor's Office of Early Childhood Education often says, decisions without data are just feelings. Decisions without data are just feelings. And I love that idea, and that's really what we want to strive for in innovation zones, is to use that data to help us make decisions, to help us improve our strategies and make things better for children and families in our community. So we want to reduce any sort of anxiety around the data and let you know that the data that we collect is collected in the aggregate. That means it's all collected together. That means no one program or one innovation zone will be put on a spotlight. Everything will be aggregated together, and none of that information will be used for any sort of judgment or any sort of vanity metrics. And we use that data to help us tell a story, to tell us about the story of our different innovation zones and innovation zones overall. So it tells us about the successes of our Altgeld Riverdale Innovation Zone. And it helps us to learn, and the data helps us to make decisions, and it helps us to grow and to improve. And the data that we're talking to you about today on the call will ultimately be used to inform the state. So inform the state of how to best provide supports for our vulnerable populations throughout the state in the future. So we'll talk a little bit more about that. Great, so our agenda today is to talk a little bit about the Innovation Zone goals and measurement plans. We'll also talk about our different roles and responsibilities with data collection, and we'll review the data collection forms, process, and timeline. And if you have any questions throughout, feel free to raise your hand or just type into that question box, and I'll pause periodically to create space for you to ask those questions. So innovation zone measurement. So as you know, the two major goals of innovation zones are, one, to increase enrollment of priority population children in high-quality early learning and development programs. And the other goal is to increase the number of programs that are involved in the Accelerate program quality process. So two major goals, one on increasing access and one on increasing quality, and that's for our vulnerable populations, our priority populations. So why are we measuring? So there's three main reasons why we're measuring. One is to really understand local level strategies of innovation zones to increase enrollment and increase quality. So we want to understand how children and families from priority populations are enrolling in high quality programs. So we understand those local strategies. So what is the innovation zone doing to improve access and to improve quality? So each innovation zone is very different. They have unique needs, unique problems that they're trying to address in their own community. And they're all seeking to address different opportunities and different ways to improve. And that could be done through coordinated intake or parent engagement, pop-up preschools, outreach plans, all sorts of really exciting local strategies, really innovative things. And we want to understand how those are working on the local level. The other reason is to help the state learn. So innovation zones serve as these really great laboratories to test out strategies. We're in a unique position to be innovative and creative and try new things within an innovation zone, and it's really exciting. And because of that, the state really wants to learn how to improve our early childhood system. They want to learn from innovation zones and from communities and from programs on what the barriers are and what's working and what's not working and how can we increase access for our highest priority populations. And through that, we serve as these really great feedback loops. So we give information to the state, they learn from us, we share with them, and it helps us to inform strategies going forward. And finally, it's to action learn. So in the innovation zone, we use this process of planning, of doing, of learning, studying, and improving, right? And that data that we collect, whether it be numbers or stories or surveys, all that data we take back in, and it helps us to learn and to improve our strategies going forward. So use it to action learn. We love to use this phrase with our innovation zones, that all roads lead to outcomes, and that's outcomes for children and families. So here again are our priority populations. So those are children experiencing homelessness, teen parents, children who are part of the child welfare system, children with developmental delays or disabilities, those experiencing poverty and deep poverty, and children who are linguistically isolated. So these priority populations will come up again on the forms that we'll review today. Sharing data with each other. So we're working through innovation zones, we're working together to identify, recruit, and enroll very high needs children in our community. So this is a win for everybody. And we can improve our system and better serve children in our families by sharing that data together. So you're probably asking, how are we going to collect this local level data? So here's a general timeline. So you'll see that we're collecting data 3 times through the end of the grant. The end of the grant is December of 2016. So 3 times, that's a number I can count on one hand, so that's pretty great. 3 times, so we're going to collect this fall. We're going to collect again next spring, and again the following fall. So you'll see that we're collecting a point in time on October 15th, 2015 for this fall. The reason we collect a point in time is because we want to get a snapshot of what programs look like, what their enrollment looks like on any given day. And this helps to give sort of a representative example of what enrollment looks like by collecting a point in time of data. So we use this date specifically because the Illinois State Board of Education uses this date, and that's because programs are generally fully enrolled at this point. So it gives us a good idea of what programs look like in terms of their enrollment number. So we'll talk about that enrollment date, that snapshot, in our forms when we take a look. All right, so we all have different roles and responsibilities with data. So our participating early childhood programs are our early childhood programs that are part of the Innovation Zone, that are working closely with us to help improve strategies and that are helping to improve enrollment and increase enrollment. So thank you, our early childhood programs that are part of the Innovation Zone that are here on the webinar today. Your role in data collection is, one, to attend this data collection information session. So that's great. You can check that off your list. And then the next is to review those forms, which we'll review today, and then to complete and submit those data collection forms. And we'll talk about the process for doing so. And your Innovation Zone leaders and coordinators also have a role with data collection. And that's to share those forms and set up this data session for you. So I want to thank Angela Bailey for that support in setting up this webinar. It's also to support you, early childhood programs, in collecting data, so helping to answer questions and provide technical assistance. And it's also to collect that data from you and turn it in. All right. So I want to pause just there for a second and see if there are any questions about the general timeline or roles and responsibilities. Feel free to type into that question box or raise your hand. Okay, I don't see any questions now, so I'm going to go ahead and move forward. But feel free to type those in as we go or jot them down. All right, so priority population enrollment forms. I like to start first with this form. And this is, I like to start here because it's not mandatory. So this form is not mandatory. It's just a tool or a device to help you in collecting the data that's needed on the forms. So this is a sample intake form that we created. It's a way, again, to collect that data that we're asking for on the forms. You'll see spots for referral sources and for priority population characteristics. I put it here next to the preschool expansion eligibility and weighted priority enrollment form just to show you how similar they are. So we're really trying to align these forms and align these systems. So again, this is a tool. This is for a program that may not be collecting a certain data point or several data points, and they need a method to do that. So this is a tool that you can use for your own program. So let's take a look at the two forms we have for enrollment. So I want to start by saying we have two different forms, and you can use either form. So you get to choose between either form. And we'll talk about the differences in the form and why you might use one form over the other. So I'm going to start with this form, HN16 Part A. It's called the High Needs Innovation Participating Early Childhood Education Program Enrollment Form. And so that's a mouthful, so we shortened the form to be HN16, and HN stands for High Needs, and 16 is the fiscal year. So I know that sounds a bit like a virus, but we wanted to shorten the name a little bit for ease. So the reason why this is Part A, because this is slightly different than our regular form. So this form we see as sort of a program total, a program summary. This is for a program that might have their own data collection system, maybe an electronic system where they can easily generate data and reports. So a program like that would want to use this form. It's an easier form for a program that has that ability to run those data reports. So let's take a look. Here's the cover sheet of the form. And here's the form itself. It's just one page. The form's available in PDF and Excel. So you can pick which either format you prefer, PDF or Excel. And let's take a look. This is the cover sheet, the top of the form, about this form. So this form goes to all participating early childhood programs in the Innovation Zone. The purpose of this form is to collect total enrollment and enrollment of priority populations. And there's also a section on the form to collect referral sources, so to understand a little bit more about the strategies of the Innovation Zone. In this form, you'll submit to Angela Bailey, and on the forms that you have, the hard copy forms, are her mailing address and her email that you can send directly to her. Again, we're collecting data on children 0 to 5, for enrollment numbers on October 15th. So again, that snapshot in time. And then you'd submit that form, and I believe Angela and I talked about having you submit them a couple days early, so we'll get to the timeline of that. But November 13th is when we're asking about to collect those forms across the innovation zones. So let's take a look. Here are the instructions. So we'll use these instructions to walk through the form. On the back page of the cover sheet is a list of definitions. So in the form itself, you'll see these table headings, and they're very brief headings, so we want to make sure to be very clear about the definitions for those headings. And these all come from research-based sources, from the census, from ICAM. And we also want to just make them very clear and defined here for you. So this is a really handy page to have on hand for the definitions of the priority populations and for the referral sources. All right, so here's the top page of the form. So this just asks basic information, program name, title, contact information, just in case we need to follow up on the forms. And then it asks what type of program you are. All right, and then here's the form. So here you'll see a space to include zip codes that children are enrolled, of the enrolled children. So we do want to say here that if you have zip codes and you're able to provide zip codes, we would really love to see the zip codes. If you don't have zip codes for some reason, or you're unable to generate that in the report, that's perfectly fine. We don't want that to be a barrier to submitting the data. But if you do have zip codes, we would really like to see the zip codes. So on this form, you would simply insert the number. So here you'd list the zip code, you'd insert the total enrollment of that zip code, and then you'd mark how many children are from teen parents. So maybe you have 12 here, maybe there's 2 children in child welfare, you put 2 here. Language isolation, maybe there's 10. So you just put the overall total by zip code in these rows here. And if you don't know, you just write the number that are unknown there. So then here in the purple box, you're able to include the referral sources, so how families within your program heard about the program. And then here in these blue boxes is where you would total the information. So you just count down the columns and include totals. And then there's a spot for total enrollment and instructions for how to include that, and total priority population enrollment. And I do want to say we have this form available in Excel, and if you use the Excel version, there are formulas already included, so the form will populate itself, which is really great. You can just put in the numbers into the rows up here, and then it will calculate for you. So that's really great and handy. And then here at the bottom, you'll see a space to insert other. So over here, you're listing the number of other, and then we are interested in what those other categories are, whatever they might be, if they don't fall into any of the other options. Okay, so there's that first form. And we ended up creating this based off of some feedback from programs last year who said they wanted just a simple form where they could generate a report and just add in the numbers from the report. So if you're a program that can do that, this is the form for you. Great. And so here's the other form. So this is HN16. This is the purple form that you have. The other one was HN16 Part A, the coral. So now let's take a look at the purple form, HN16. Again, this is available in PDF and Excel. The instructions are basically the same. You'd be submitting again to Angela and the same timeline for doing so. Here are the instructions to the form, slightly different from the other form, but we'll go through that looking at the form itself. So here's what the form looks like. A little bit closer for you. You can see a little bit bigger. So very similar to the other form, and we'll talk about the differences here. So you'll also see the same definitions. So on the back of the cover sheet, you'll have the same definitions there, just to make things a little bit easier to have them right available on the back sheet there. And then a little closer with the definitions. Feel free to let me know if you have any questions about these definitions, if we can clarify in any way. Great, and here is the top section of the form. So you'll see you'll include the same basic program information at the top, and then here, instead of listing just zip codes, you'd include child ID. So again, this is for a program that might not be able to generate a report, and they need to include individual information of the children to then be able to calculate in total. So we're asking for child ID, a child identification number, because we don't want sensitive child information. So we're asking that you not share names, so you can keep the names for your own records, but just provide a child ID number. So let's say you already have used child ID numbers. You could just use the same child ID numbers you already assign, or you could assign your own simple coding or numbering system to create a child ID. So you'd insert that child ID, and then the zip code that that child lives in, and then you just go across. So if this first child here is experiencing homelessness, you mark 1, and let's say they're also living in deep poverty, you mark a 1 here. So it's possible for a child to be experiencing multiple priority population characteristics. And again, if you don't know, you just mark 1 don't know. If they don't fall into any of these, you put a 1 here in this column. And then here, the purple section, you'll see for referral sources. So that's where you can mark a 1, check all that apply for the different ways that that individual child and family heard about your program. So here again are the definitions for referral sources. You can see that again on the form. And then here's the back page of the form. And so here's where you would do some calculations and total up the columns. So here you'd provide totals for each column. You just add those up. And then total enrollment and priority population enrollment. And we have instructions for how to do so on that cover sheet. Great, and there's a closer look there. And then again, this form is available in Excel. So if you like Excel, have access to Excel, this is a great way to calculate the totals. The formulas, again, are all there. So once you start entering ones in these different columns, it will calculate for you down here. Great. Any questions about either form? Any questions about HN16, the purple form, or HN16 Part A? Okay, it doesn't look like there's any questions at this time. So I just want to say again that you can use either form. So you get to pick between either form, whichever form works best for you. So you can choose between HN16, that's the purple one, where you can insert individual child information without the names, of course, and then include the totals. Or you can use form HN16 Part A, the coral form, and that's more of a program summary or a program total. So again, those are available in PDF or Excel, whichever you prefer. All right, so let's look at some key dates for data collection. So you'd be choosing between either form, and it would be the participating early childhood program that would complete that form. So it would be either a director, administrator, or intake person at the program that would share this data, collect this data. You're collecting on the enrollment date of October 15th, and you'd submit that data to Angela, to the Innovation Zone, on November 10th. So their Innovation Zone is asking for it on the 10th, so they can have a couple days to review that, follow up with you, and then submit to us. So November 10th is the due date. And you might be wondering, where do we send that data? So there's a few options. You can email that directly to Angela, or you can mail your forms to the address on the screen that's also on the cover sheet of the form. And if you have any questions at any point, you can call Angela or you can call me. Feel free to pop me on speed dial and just give me a call at any point. Great. Oops. All right, here's another one that another image that I love. It says, not everything that counts can be counted, and not everything that can be counted counts. And there's no story without data, and there's no data without a story. And that's just to say that the data collection forms that we're using is really one piece of the puzzle, right? So numbers can tell us one piece of what's going on in Altgeld, Riverdale, and what the successes are of the innovation zone. But we understand there's more to that, right? And we need to hear the rich stories. We need to hear from families, from programs, from innovation zones on what's happening, because that really helps to paint a clearer picture about the successes of the innovation zone. So there'll be other opportunities throughout the process, throughout the innovation zone initiative, to share your stories, to provide information through surveys, and possibly through interviews and focus groups as well. All right, so in going forward, we just wanted to touch on how you might collect data going forward. So as we mentioned at the beginning, you'll be collecting data 3 times through the life of the grant. So this fall, next spring, and again the following fall. And we want you to be prepared for that data collection cycle when it comes around again. So we really want to encourage you to collect data going forward in the process that works best for you. So some ideas are that the program might choose to collect information at the time of intake or enrollment. So you might use your own enrollment form or intake form or the sample intake form that we provided to collect that data right when a child enrolls in your program. You might also add just a couple of data fields to your own intake form. So maybe just adding a question or two for families when they fill out your own form. You might also decide to add newly enrolled children to the existing HN16 form. So let's say you're using HN16. When a child comes into your program, you could add their information, what priority population characteristics, and referral sources for that one child. And then come spring, on that enrollment date, you could drop that child if they're no longer enrolled and just cross them off the form. So we're open to your ideas too on what might work best for you in collecting data going forward. All right, I just want to pause for a second. What do you need to be successful in collecting data? What will support you in data collection? So feel free to type into the chat box or raise your hand and I can unmute you. What would help you to be successful in collecting data? What would make it easier? Well, I have a few ideas for things that we might be able to offer. One that's hosting a data information session. So that's today, providing the forms and the tools, answering questions throughout the process, regular reminders, triggers to help you along the way to remind you about data collection. There's also an option to review your own intake forms and help translate your intake forms to what's needed on the data collection form. I've done that with some programs in the past. There's also an option to go out to your program and help transfer that data. So we really do want to help you in any way that would be useful. And we just encourage you to reach out, ask questions, ask for support. So there's many options, and we're really open to your feedback too on what would most help you. So just a quick review of some of the steps. So after you leave this webinar today, you'll review those forms. Angela will share those forms again with you. So review those forms. You already attended the data information section, so that's great. You'll collect data on October 15th at a point-in-time snapshot. You'll turn it into the Innovation Zone to Angela by November 10th, and then you'll ask questions early and often. All right, so here's some tips for successful data collection. That's attend this data info session. So good job, you got that crossed off. Review all the forms. So definitely after you leave here today, if you have questions, let us know. Use that sample intake form if it's helpful to you. Ask questions early and often. Do reach out for support. And it's always good to review those forms before you submit them. So I always like to hand off my forms after I look them over myself. I give them to a colleague to let them take a look and see if there's anything I missed and make sure what I'm submitting is clear. That's another great suggestion. And we'd love to hear your tips and ideas too for successful data collection. All right, so after reviewing the data collection forms, process, and timeline, I'm curious if there are any questions. And feel free to type your question into the question box or raise your hand and I can unmute you so you can ask your question aloud. All right, I don't see any questions coming in at this time. I do want to encourage you though, after you leave today, after you process all this information and take another look at the forms, if you have any questions at all, please reach out to either Angela or myself. And my information will be sent out to you after this webinar. So I want to thank you so much for your time today. We really appreciate your support in collecting data and in being a part of the Innovation Zone. You're really making a difference for children and families in your community. So thank you for all that you do. I hope this presentation was helpful, and we really look forward to working with you in data collection. So thanks so much, and have a great day.